Today we'll share images of a patient who underwent a closure of a hole between the two atria known as an atrial septal defect, which we see in children. During evaluations after our children are born, holes can sometimes be detected in the heart. These holes can be between the atria, the ventricles, or between the aorta and the pulmonary artery. The most common ones we see are holes between the ventricles and the atria. When holes between the atria reach a certain age and are above a certain size, they need to be treated interventionally. This can be done surgically or angiographically. Ideally, in children over 10 to 15 kilograms and 4 years of age, holes between the atria, called atrial septal defects, can be successfully closed. In suitable patients with the right selection, this procedure can be completed with nearly 100% success. Here, we'll talk about the angiography, where we close the hole between the two atria in the heart of our patient, who is about 4 years old and weighs 15 kilograms. First, our children are admitted to the hospital either that morning or the day before. We start the medication called aspirin. After explaining the procedure to them, we take them to the angiography room. After taking the patient to the angiography room with the anesthesia team, we put our patient to sleep. By inserting a tube through the mouth, we connect their breathing to a ventilator and ensure the heart is imaged with a camera through the mouth. The first thing we do here is evaluate the hole inside the heart with an echocardiography device we insert through the mouth called a T. When we evaluate the hole, if it turns out to be a hole suitable for closure with angiography, we continue with our procedure. We cover our patient. We place our cannula, called a sheath, into the vein in the leg, through which we'll send the small tubes to perform the procedure. When we place this with ultrasound in small children, there is only one puncture in the leg and the possibility of bruising is significantly reduced. Then, as seen here, we take our catheters all the way into the heart. The first thing we do is a hemodynamic evaluation. We take blood samples and determine the size and width of the hole. At the same time, we complete the patient's evaluation by taking the pressures of the lung and the heart chambers. The second thing we do here is cross to the left side through the hole in the heart. After our long sheath, called the delivery, crosses to the left side, we advance our device through it. Our device has two discs. This is a device commonly known as an umbrella device. Left and right discs. We need to leave the left disc on the left side of our heart and our right disc on the right side. However, in some children, due to the hole being very large or the absence of what we call rims where the device can attach, we can perform this procedure with different techniques. In this patient, our rims were sufficient. Again, we have different devices available. These devices can be preferred in different patients according to technical conditions such as softness, the distance between the two discs, and whether the patient has rims. Since the hole in this patient was close to the aorta, we used a softer device from a different brand. After reaching the left side, we open the left disc. As seen here, we lean the device towards the right side. When the waist is right over the hole, we open the right disc and both discs are then deployed. Then, as you see here, we inserted the camera down through the mouth. We evaluated the device. After ensuring the device doesn't press on the heart chambers and confirming it's well placed, we released it as seen here. Afterwards, we check the waist, and after rechecking with echocardiography, we conclude the procedure. We wake the patient here and monitor them in the coronary ICU for about 1 to 2 hours to keep them under observation before the ward. Families can accompany their children here. Then we move them to the ward. To avoid any risk or in case of complications, to keep the patient under observation, after monitoring in the hospital for 24 hours, about a day, we send the children home safely. Get well soon. I wish you healthy days.